zilikuwa zikifanyika kirudisha bandarini. Gavana wa Odessa yeye amesema kwamba makombora mawili ya meli yalishambulia meli.
Hello. Hi. Can you hear me? Hello.
Hello, we can hear you.
Okay. I don't know what happened. I guess the connection got lost and I was still presenting. So I think I will start again. But from time to time, I will then cue you to find out if you can hear me or not. Sawa. Is that okay?
Yes.
Okay, so let me then share my slide. Share my slide. So it's telling me that only the host can share in this meeting. Isiana, I don't know what has happened now. Okay. Isiana, are you here? Can you hear me? It says that only the host can share content, so I can't be able to share my content. I don't know if she's in. Okay. Okay, share screen.
You can now share.
Hello?
I can see
You can see. Okay, sawa. So let me then share. Are we together? Because now I can't see you because I'm now on my screen. So I need someone to confirm that you can still hear me.
Yes, we can hear you.
Okay, great. So from time to time, I'm going to then ask just to confirm that we are together because I was almost done with the presentation and clearly I was presenting to myself. So yes, I'll just make some stops in between. So we'll just take it from the top. And our topic today is about fertility and premature menopause. Now, our goal is to be able to define what fertility is and some of the factors that are associated with poor fertility or infertility. And then we are going to try and understand what exactly is a fertility window and ovulation. And then talk a bit about infertility and ways of managing this. And then finally, we're going to talk a bit about premature menopause, some of the causes and how to manage them. Okay. So great. So I think we're together. So from the definitions, fertility is basically the ability to get pregnant and to have children by natural methods. So that's through having sex, right? Now, a common question that's asked is what measures fertility? When a doctor says you have 50% chance of getting pregnant or 25% chance of falling pregnant, what does that mean?
Excuse me.
Yes.
Are you sharing your screen?
Yes, I am. Are you able to see it?
Like, we can't see the notes. Amani, you can't go on my side.
What are you seeing on your side?
Your background, your profile.
Wow. Okay.
Yeah.
So you're not able to see the notes at all?
Yes.
Hey, okay. This, let's see. Is that the same for everyone?
Yes.
Okay, fine. Let me just change this machine that I'm using because I think that could be the issue. Just give me a minute.
Hello.
Hello.
I'm thinking that you can maybe share your slide through email to one of the hosts, and then the person who is the host now can actually share, and you can just take us through. That's another alternative way of doing it. You then ask them to send you their email address, you send to them your slide, and then the host can share the slides, and then you can be basically taking us through. That's another way of trying to navigate this problem.
She's not in. Let me tell her.
Oh, okay. Who are the leadership in terms of the host? Who is the host?
Hello. I'm trying to reach her through WhatsApp.
Hello, Muluka. Hello. Hello.
Hello? Hello?
I was saying
Yes?
another way of navigating this.
Yes?
You can basically share your slides with maybe one of the host members through an email.
Let me send them to Isiana right away.
And then that way now she can just share, and then you take us through.
Okay, that's perfect. Isiana, I'm sending them to you directly. Just, I've got an email address, so let me just send them.
Just ask whether she is.
It's okay. I just say no. Hello. Can anyone see the screen right now? I've sent it to Isiana. Isiana, confirm once you get it. And then also let me know if once. Can anyone see my screen right now? And then Isiana, also let me know if you've gotten the presentation.
We can see it.
You can see it right now.
Yes.
Yes, I can see it.
Yep.
And so when I move like that, are you also able to see?
Yes.
Okay, great. So let's take it from here. I think we had reached this slide, the second one. Okay, great. So basically we were talking about fertility. And so in terms of definition, it means the ability of a couple to get pregnant and have children through natural methods. So I mentioned that sometimes there's a commonly asked question when people are trying to find out what exactly is a measure of fertility. When a doctor says that you have a 50 or 80% chance of getting pregnant, what do they mean? And so what basically happens in studies, people have seen that if you take 10 couples and follow them through for 1 year, you'd find who've been trying to get pregnant, you find that 8 out of these 10 will get pregnant. Can you hear me? I had a weird sound, so I don't know. Am I still audible?
Yes, we
Yes,
can
you
hear
can.
you clearly.
Thank you. Okay, fine. So basically, you find that 8 out of 10 couples will be able to fall pregnant within 1 year without having any interventions, right? And without even having to overly do any form of tracking of their cycles. And so you find that if you ask a doctor, how likely am I to get pregnant this month? It's been shown that in the first month of trying, there's a 30% chance of falling pregnant. Okay, so that's basically by and large what we're usually referring to. And then when we talk about ovulation, first it's important to understand what's the significance of ovulation and what exactly is it. So for one to fall pregnant, an egg has to come out from the ovaries, which are the gray colored shaped things there. And so the egg comes out usually for about 12 to 24 hours each month in a lady's cycle. And for you to fall pregnant, then the male sperm has to come and meet with this egg during this period of time, okay? So conception occurs once the sperm and the egg meet, and then after that now, the embryo that's formed is then implanted into the womb of the lady. Now, the highest time chances of pregnancy are usually within 24 hours of ovulation and a day before ovulation happens, okay? So I hope that one is clear. Now, how does someone know that they are ovulating? There are usually physical changes that occur, and some ladies experience them, some ladies do not experience any whatsoever. So some of the common ones that some people will tell you is that they experience some spotting during this time of the month, others experience menstrual cramps. There are those who notice changes in their mood, and then some may notice that the breasts become a bit fuller and they're a bit more painful when they're touched. Some people may have a heightened sense of smell, but there are those that ladies are advised to look out for specifically if you're trying to identify whether you're ovulating or not. Maybe you're trying to get pregnant, and you find most literature will tell them that they can check their body temperature, and usually a slight increase in the basal body temperature. So normally one has to kind of monitor their temperature to know what their normal temperature is, and then on the day after ovulation has happened, the temperature then tends to go up. Then you can know, okay, fine, I ovulated, okay? Then there's that school of thought whereby you can be able to monitor the cervical mucus, because this is known to change during the time of ovulation. It increases in amount, and it's quite thick and slippery, okay? And it's usually kind of clear. So it's not really white, as white as sometimes it can get during the cycle. Now, there are other methods of finding out whether you've ovulated or not, and some of these are what we call the ovulation predictor kits. These are sold over the counter by and large, and they are kind of like the pregnancy test. So a lady pees on them, and it measures a specific type of hormone known as luteinizing hormone, which goes up usually at the time that you're ovulating. And so it can be able to tell you, okay, fine, you're likely ovulating today, so one can then engage in sex during that day. Now, technology has advanced, and so nowadays we have fertility bracelets, one of which is called Ava Fertility. And these ones, besides monitoring the body temperature, it monitors other changes in the lady, which have been seen to occur at night. So normally what happens is that you put on the bracelet and you sleep with it. So you like a watch basically, and it's able to monitor your temperature, it monitors your heart rate, it monitors how you're breathing. And so from this combined data, it's able to tell you that you're likely ovulating. Okay, so it's been shown to have helped a good number of ladies who have been trying to conceive. Now, another common question that is asked is, can I get pregnant a day before my fertile window and 2 days after my fertile window? So that then begs the question, what is this fertile window? Okay, because we've spoken of ovulation and we said ovulation happens, in a cycle. You have that time that the egg comes out and it's in the reproductive tract for about 12 to 24 hours. So what exactly is a fertile window? Now, the fertile window is usually a 6-day period, which usually includes the day of ovulation and the 5 days before that. Okay, so I'm going to try use this example on the right side of the screen. I hope we can all see it. So, right together again. Okay, good. I think I've had a sound, so that means we're still together. So basically for this lady, you can see her period was on the 2nd of December, 2017, and the cycle is 28 days. What we mean by your cycle length is the time from which you started having your period to the next period. So for this person, it takes 28 days in between. So if her period was on the 2nd, which is a Tuesday, then normally you ovulate 14 days before your next period. So if by 28, she's already the 28th day, because that's a 28-day cycle, she's already receiving the next cycle, the next period, then that means that she's ovulated on day 14. And so day 14 of this cycle is from 2nd of December is on the 15th of December. And so that day and the 5 days prior to that are the fertility window. And this is basically the period of time that you're most likely to fall pregnant. So if you're trying to get pregnant, then that's the time you should be trying to conceive. And if you're also trying to avoid pregnancy, then that's the time that someone should know that those are then unsafe days. Okay. So why is it that it is 6 days? It's because, and yet we said that the egg is only available for up to 24 hours in a lady. So the reason is that the male sperm has been shown to be able to survive in the female tract for a period of 5 days. And so that's why you find that we have this 5 days prior to ovulation and then the day of ovulation. It doesn't extend past ovulation, the ovulation day, because you're not likely to fall pregnant after you've already the day after ovulation, because this egg is only in the tract for 24 days. So if it's been released on the 15th, so by the time that day is over, then you're not likely to fall pregnant. So I hope we've understood that. Okay. Again, I'm just checking. Are we together? Can you hear me?
Yes.
Okay,
Yes.
perfect.
Yeah.
Thank you. So another commonly asked question is, at what age is a woman most fertile? Okay. Now, about the fertility timeline, basically, the most important thing to understand is that ladies are born with all the eggs that they'll ever have in their lifetime. And by the time you are born, you have about 1 million eggs or so. And they die off every month, because obviously one cannot have 1 million children. Now, the speed at which they die off, usually when you're younger, like from the extreme left, you can see 18 to 24 is the best age to procreate from a physical standpoint. The rate at which the eggs are dying off is rather slowly, okay? We can see from 25 to 30, then it's slowly increasing. By the time you're in your mid-30s, significantly increasing. By the time we're getting to above 45 years, then really the rate at which the eggs are dying is really fast. It's thought that by the time you're getting to 30 years and mid-30s, you've literally about 90% of your eggs are gone, are almost gone. Then by the time you're getting to your 40s there, you're only having like about 3% of them left. So really, age is a significant thing that affects one's fertility, and that's especially for ladies, that's something to note, okay? Now, so other factors that then affect fertility, we can see age, we've talked about that. Then timing of intercourse, we've talked about the fertility window. So obviously if you're having sex outside the fertility window, then likely you may not get pregnant at the right time. Then the other things that then affect one's cycle and whether or not they are ovulating. So things such as excessive exercise, or someone who has an eating disorder or use of certain medications, and even someone's body weight. If you have like a very low BMI or a very high BMI, those are things that can cause a lady not to ovulate. And so that can affect her fertility. Now, there are other things which are known as toxins, which have been shown to basically affect the quality of the eggs that you're producing and can even target the number of eggs that you have to cause them to now die off sooner. And these are things like smoking, excessive alcohol intake, and also excessive intake of caffeine. Yeah. So when we talk about infertility, this is a term that's used to describe a couple that has been trying to conceive. So both the man and the lady for a period of 12 months, they're having regular intimacy. They're not using any contraceptives, but they've not been able to succeed. And by and large, this term is being replaced by another one, subfertility, because it's been found that out of the people who are labeled as infertile, basically those who've been trying for 12 months or more, about half of them will conceive naturally after they've been given a bit of advice or minimal treatment. So infertility comes with kind of a tag of finality, but when you use the term subfertility, at least it shows that there is a possibility, maybe just more of a delay in conceiving. Now, when you talk about types of infertility, we divide it into what we call the primary infertility or secondary. Now, primary is a couple that has never been able to conceive, and so they've never had any pregnancies. Whereas now secondary infertility occurs when previously a couple has been able to conceive, maybe they have a baby, or maybe the pregnancy was lost because it was either a miscarriage or an ectopic pregnancy, but they've been able to conceive. And then now they've stayed a period of 12 months and they're not able to conceive again. Okay, so that's what we call secondary infertility. And so what are the causes of infertility? So the first one would be if the egg is not coming out, we're not having ovulation. Then we talked about this egg needing to pass through the fallopian tubes because this is the pathway for these eggs. So if these tubes are damaged, then that could be another factor. And then in this uterus where this fertilized egg is supposed to grow, if there are disorders that affect the uterus itself, things such as fibroids, other things like anatomical disorders, like sometimes you can find there's a big band that is inside the uterus, what we call a septum, that can affect fertility, and other gynecological issues such as endometriosis. Okay. Now, on the male side, we can have problems with ejaculating. And then sometimes they are ejaculating, but there's a problem with the sperm. So usually a function of the quality or the quantity, that's then usually an issue on the male side. Then there are other people who we do investigations, but we don't find any causes in either the man or the lady. So that's where we call it unexplained infertility. Now, according to a WHO study, and the point of this slide is to just emphasize the significance of why we need to have both the lady and the man coming in when there's an issue of fertility, is 50% of the time you find that the lady has an issue, 30% of the time it's a man who has the issue. But in 20% of the time you find that both the man and the lady in this couple have an issue. So it's really important to have both of them present so that even as you start off on the journey of investigating, then you're able to investigate both at the same time. Now, what are the investigations we do and when do we do them? So usually people decide that, okay, we want to have a baby. And so they try to have, and maybe after 2 or 3 months, they're like, there is a problem. Why are we not getting pregnant? There's some people who just literally cough and they get pregnant. So they come in. But usually we do not advise for investigations to be done before 1 year mark has taken place. And this is, as I told you, the longer you try, then the higher the likelihood of you falling pregnant. So unless now there are other issues, then we investigate earlier. But however, if by and large, there's no issue, you've had, after your doctor listens to your history, both on the male side and the female side, they may tell you that there's really no need to have any tests done. Just come back, continue trying, make use of the fertility window and come back when it's been more than a year. Okay, but there are those people in special categories that we may want to investigate earlier. And so those would be ladies who don't have regular menses. And so basically, you're not getting your period every month by and large. So sometimes the period may come in earlier by a day or two or later by a day or two, and that doesn't constitute an irregular menses. So it needs to be a duration of time that is significantly large, about a 7-day jump from what is normal, then that would then constitute us to want to worry. Most cycles are between 21 days to about 28 days. Now, if a lady has had any prior surgeries in the pelvis or even in the abdomen, sometimes if you've had an appendicitis or if you've had an ectopic pregnancy, then you may want to investigate a bit earlier, as well as someone who has had a history of having sexually transmitted infections or pelvic inflammatory disease, and they're trying to conceive and nothing is happening, then usually by about 6 months, we would want to investigate. Same thing for those ladies who are above 35 years. If they've been trying to conceive for a period of 6 months, then we usually want to investigate. And the last thing is if they've had any treatment for cancer, chemotherapy or radiotherapy, because these are toxins that can actually cause damage to the ovaries. So we would want to know, do we still have any eggs left in there? And then to try and see what can be done for them. For the men, basically it's issues that affect the groin. So if they've had any surgeries, if they're having any swellings in the testes, and even if they've had any treatment for cancer as well. And then obviously the men who are having erectile dysfunction would also need to be investigated a bit earlier. So when we do investigations, we usually have a goal to them. And one is to find out what the problem is and then come up with a plan of management. And normally we aim to complete this test within a period of about 4 months. So you may walk into the gynae's office and expect that you'd walk out with a diagnosis as to what's causing the infertility or subfertility, and you're told that you need to do certain tests at specific times of the month, especially for the lady. And even for the man, there's usually certain prerequisites that you must meet before you can be able to run the tests. Okay, so that's one thing to keep in mind. But by and large, we want to find out if the lady is ovulating. If she's not ovulating, why isn't she ovulating? And is it something that we can correct? Then we want to look at the fallopian tubes, which we mentioned at the channel for those eggs. So want to know, is there any disease in these fallopian tubes? And then when you talk about ovarian reserve, we have talked about how the lady loses the eggs over the years. We want to see how many eggs do you have left. And then lastly, we want to check, is there any abnormality in the uterus? Now for the man, we want to find out if there's any sperm in the ejaculate, because the fluid that comes out, the ejaculate, usually has a combination of several fluids as well as sperm. So we want to know specifically, is there sperm inside this ejaculate? And if there's none, why is it not coming out? And then we also want to find out whether this sperm basically satisfies the criteria of being called normal sperm. Now, normal sperm usually has a specific way that it appears. It has a head, body, and tail. There's a specific way that it moves. And there are other tests which the sperm is then taken through so that it can be said that this is normal or abnormal. So that's by and large what we want to find out. Now, we had mentioned how a lady can identify if she's ovulating through the signs that take place in the body, but there's also tests that we can be able to do. So besides those ovulation kits that one can buy over the counter, besides the bracelet that one can wear, we can be able to run hormonal tests. And there's a way that the hormones change after you have ovulated. A specific hormone called progesterone starts increasing steadily after ovulation. So we tend to measure this hormone, and then we can also be able to do what we call tracking of follicles. So on the right, you can see an image of the ovaries. So the white thing, the predominantly white thing there is the ovaries. And I don't know whether you can see a bit of the red inside the white. Those are the follicles. And so what we do with the ultrasound tracking, we are able to do serial ultrasounds to see whether we will see these follicles. We follow them up to the point that we see that it has disappeared. And so that means that one has ovulated, okay? To establish how many eggs a lady has, there are hormonal tests that we can do for this. And so those are, one's called the AMH and the one is the FSH. Then you can also do this by, again, ultrasound based, whereby we literally go in and count how many follicles a lady has. Okay, so these are the tests that are carried out to see whether the tubes are patent or basically blocked or not. And so we can see on the extreme left, just trying to depict and what a normal picture looks like. So at the bottom, we have a dye being passed through the vagina. It gets into the uterine cavity and it goes all the way through the tubes, and we see it spilling into the abdomen. Okay. In the extreme right, we can see that the dye did go in through the vagina into the uterus, and we can see something that's swollen like sausages at the end. And that's usually a form of tubal disease that we call hydrosalpinx. So basically the tubes were damaged. And so when the dye gets into them, it's blocked. So it can't get into the abdominal cavity. And so that means that even the sperm, when they're trying to find their way to the eggs, likely they're not able to, because the egg is not able to come in through this type of tube. Now, when you talk about tubal disease, this is what it kind of looks like at a microscopic level. You have scar tissue forming in between the tube and the ovaries. Now, the white adhesive band, that big band that you're seeing there, is representing the scar tissue. And what it does, it literally causes blockage. So on this end, we can see the thing with the yellow sort of cyst-like structure. That's the ovary. The whole thing is the ovary, and that's the egg that wants to come out. However, you can see that its path is kind of blocked, and so it can't get into the tube. So every month, a lady may be getting periods because, yes, she's ovulating, but however, this egg that she's ovulating is not able to pass and to get into the tube. And even if it gets in, there's another obstruction inside the tube. You can see there's lots of scarring in the tube itself. So this is what tubal disease looks like, if you can imagine it at the microscopic level. Now, when we want to talk about the uterine abnormalities, we mentioned fibroids. And so this is how fibroids are significant in terms of fertility issues. You can see there's one that's right in the center, the one that's labeled as intracavitary, the one and the one that's close to the center, the submucosal ones. Those are the two that are notorious for issues associated with fertility, because literally it's occupying the space or close to the space where the baby would grow. And so it causes issues even in terms of the implantation. So even if fertilization takes place, then that early conceptus baby cannot be able to implant inside the uterus. There are other fibroids that sometimes you find are seated right next to where the fallopian tube joins the uterus. Now, those ones also cause blockage. And so obviously if there's something right there, then the egg and the sperm again cannot be able to meet. So there are other relevant hormonal tests that we do generally when we are examining ladies to see whether they are ovulating. And so this is a list of them. So just to complete the profile of examination, these are some of the tests that may then be carried out. Significantly is a thyroid function, because sometimes you can find that ladies who have thyroid disease can then have issues with ovulating. Now, when you talk about the male infertility, I've mentioned this, but the problems usually come about either they have an abnormal sperm or reduced sperm count, or there's no sperm in what is being produced as they ejaculate. And a thing to note is that men produce new sperm every 90 days. Unlike ladies who are born with all the eggs and they keep diminishing as time goes by, for men, every 90 days, they produce a new batch of sperm. So even if one test is done and it's found to be abnormal, then there are usually some corrective measures, maybe in terms of supplements that may be given. And then after 90 days, then a man is asked to repeat the sperm test to see whether the issue that had been picked initially has maybe been corrected. So the test is what we call the semen analysis. That's what I'm talking about. And then the other hormonal tests, these are the hormones that affect the production of sperms, which can then be run. And then sometimes if there's swellings in the scrotum, we may want to do a scrotal ultrasound. Basically, we think that maybe there could be an issue in terms of blockage and we want to see maybe if there's no sperm at all in the ejaculate, then that's when we run an ultrasound. And when it comes to treatment, as I've talked of several causes, then the treatment is usually directed to whatever is causing the issue. So I'm just going to check in that we are still together before we move into the last thing that we're talking about, which is premature menopause. Are we together?
Yes, we are together.
Perfect. Thank you. Thank you. Yes, I hear you clearly. We're together. So great. So we're going to shift gears. I mean, still in the same line of talk, but now we are moving to the end of reproductive age for a lady. And that's what we call the menopause. Now, specifically today, we're going to be looking at what is premature menopause. And I'll start by explaining what menopause is. Menopause is a time in a lady's life when she stops having periods, okay? So the periods end. And there's no other cause for this. It's important to mention that. So she's not on any contraceptives or having any other disease process that is known to be the cause of that. And usually menopause is something that we diagnose, we say retrospectively. So usually we diagnose it after you've stayed 1 year, that's 12 months of not seeing periods, yeah? And in our setup, the median age of ladies experiencing menopause is about 50 years. So sometimes you'll find ladies saying that I haven't seen my period for 6 months, I think it's menopause. No, that's not menopause. Until it gets to 12 months, it is not menopause, okay? And if someone is maybe having a method of contraceptive that causes them not to see their periods, then that does not qualify as menopause, okay? Now, when we talk about premature menopause, we're talking about this happening. You stop seeing your periods for a period of 12 months before you're 40 years old as a lady. Now, that's what we call premature menopause. And so we're going to try to talk a bit about it in terms of what causes it and what can be expected. So first, we'll talk about what happens in terms of menopause. And this is the same thing that one experiences now when they're having the premature menopause. So what happens in menopause is that the hormone estrogen that is produced by the eggs, the ovaries, stops being produced. So ladies tend to have several symptoms because of this withdrawal of this hormone. These symptoms usually come in slowly. So there's what we call the premenopause period or the premenopause years. And so this is what they tend to experience, okay? So whether the menopause is occurring prematurely or it's occurring at the time that it's expected to occur, these are by and large the symptoms that occur. The most significant ones that people usually mention are the hot flashes, whereby a lady experiences sudden heat over the whole body. And then at night, they feel lots of heat, sweating a lot. And then this now then changes with cold flashes. Then significantly, there's usually vaginal dryness. And this again is because of the withdrawal of the estrogen hormone. And so that results in lots of discomfort during sex. And these are things that people need to be aware about because there are ways that we can be able to deal with these symptoms, right? Then again, they may have more likelihood to get urinary tract infections in this period of time. They get lots of mood swings. There's some ladies who experience a lot of anxiety and some mild depression. It's been associated with difficulty in sleeping. And then also a change in the sex drive, most reporting a decrease in the sex drive. And then estrogen is a hormone that tends to be very protective and good for ladies. So once it starts going down, then now they start having difficulty concentration, having memory lapses, and also associated with, in some women, with weight gain, okay? So those are by and large most of the symptoms, but there are others who get now different or none of these symptoms, and the severity of the symptoms ranges from person to person, okay? So what then causes premature menopause? So there are certain things that can cause you to have premature menopause. And some of these are like having a surgery whereby your ovaries are removed. The ovaries are the source of this hormone estrogen. So if you have a surgery where they're removed, then you are that is a direct cause of premature menopause. Smoking has been shown to have toxic substances that directly affect the ovaries. And so basically it can be associated with premature menopause. And then again, if you have a surgery to remove the uterus, but usually the uterus plus the ovaries, that's when now you fall into that premature menopause group. And then as a side effect, again, for the radiotherapy and chemotherapy, I'd mentioned that this is usually quite toxic to the ovaries. And then there's also a link to family history. So if you have a mother or a sister who has had menopause before the age of 40, then it's been shown that that could then happen to someone in the same lineage. There's some medical conditions also that are associated with premature menopause, and significantly, I'll mention what we call the autoimmune diseases. These are diseases whereby ladies tend to have, or basically, when you have an autoimmune disease, what happens is that you produce certain what are called antibodies. It's your immune system that's attacking your body. Antibodies are usually produced to help you fight a disease, but in this state, they're being produced and they are going to fight against your body. So for those who get premature menopause from these diseases, which include lupus, rheumatoid arthritis, the inflammatory bowel disease, it's shown that the antibodies that they are producing at this point in time are now directly attacking their ovaries. And so that can cause them to get premature menopause. Now, a question that is frequently asked is, can premature menopause cause health problems? And the answer is yes. It's actually been linked with various diseases that are neurological, such as dementia. It can be associated with sexual dysfunction, heart disease, issues with the bones, so osteoporosis, which is known as brittle bones. So a lady is more likely to get fractures if she has premature menopause, as well as being linked to earlier death. And this is not just to be because of the fact that once estrogen is depleted, then there's risk of also having some heart diseases and now sudden earlier death. So how do we make a diagnosis? Basically, if the history fits the definition, which is she's less than 40 years and she's not had a period for 12 months, and there's no other cause for this. Okay, and so at that point, we usually do some hormonal tests to confirm this, which usually shows that the levels of estrogen are reduced. There's a specific hormone that is that now tend to go up, which is the follicular stimulating hormone and also LH. But significantly, the FSH1 is the one that now tells us that this lady is likely in menopause, and it has happened before the age of 40. So how do we treat this? Now, the mainstay is usually to give hormonal replacement therapy. And so there are different types of replacement therapies that are given, but the main hormone we want to give is estrogen, but we tend to give it in combination with a second hormone known as progesterone. And so this tends to help with some of those symptoms that she's experiencing and also to prevent some of the complications that we have talked about in the various systems. Now, a final question that is frequently asked is there a possibility of a woman who has attained menopause getting pregnant? And the answer is no, okay? Once you have attained menopause, then usually one is not able to get pregnant because you don't have any more eggs left, okay? However, there are some people who have had periods of time that maybe they've not had a period, or they have irregular periods because of other conditions, and maybe they had thought that they had achieved menopause and they do fall pregnant later. So there are some of those incidences. There's also what we call premature ovarian insufficiency, whereby the ovaries are not functioning as normal. And so a lady may have irregular menses, and this can also be due to several conditions, but those ladies now do have a chance of getting pregnant. But once you've achieved menopause, whether it's premature or it's at the right time, usually there's no possibility of getting pregnant naturally, basically, yeah. And so that's the end of our presentation. Thank you.
Thanks for the session, but the Geneva has been
I'm sorry, I'm not.
I can see Teresa has raised her hand. Maybe
Okay.
she can ask.
Okay. My question is,
Yes.
what about I don't know the name, but menopause in men?
Oh yes, Teresa, that's a good question.
Do they experience this?
Okay. I think I've gotten your question, Teresa. You've asked, what about menopause in men? Do they experience the same thing? Yeah. So for men, there's what is called andropause. And for them, it's not as clearly defined as for ladies, because for ladies, we know that there's a certain mark and we even have an age at which it happens. But for men, it's called andropause. And basically, they've also been shown to have a change in the amount of the male hormone that they have, and that is testosterone. And so they may then start experiencing some changes as well. And significantly, there's people who have actually studied to see about the sperm that they produce. Is it of the same quality that younger men produce? And it's been shown that it does change, but men are still able to produce sperm even up to the ages of 90 and 100 years. So they don't have a defined age whereby they can no longer reproduce. Because, you know, that's usually the main thing about menopause for ladies. So for men, they do undergo some changes, and they may also experience certain hormone changes, such as, you know, they may start having issues in terms of memory. They may have changes in other body systems, but they do not have a defined specific period of time that they do not have sperm. So that would then be the equivalent for them. I hope that answers that.
Yes.
Okay. Any other questions?
Yes, I have a question.
Right.
Ovulation and sex of the baby.
Mm-hmm.
I don't know if this is a myth or, you know, it's actually scientific, that for boys chances are high after ovulation, while you can get a girl at, you know, anytime. So I'd want clarification on that.
Thanks, Biko, for that question. It's a very common question that we get because sometimes you find that if a couple has had one gender as a first baby, then they may be trying to have the other gender. And so they want to know, what time should I do this? Okay, so there are theories about it. And where the whole theory comes from is that the speed of movement of the male and female sperm has been studied, okay? And so, and also in terms of how long the sperm then stays as well, you know, thought to stay in the female tract has also been studied by some people who have now come up with these calendars and given ladies different days as to when to then try and get male or female gender. And so basically what they have shown is that the male sperm tends to move very fast, but it doesn't survive for long in the tract. The female sperm may not move as fast, but it survives longer. So there's people who say that if you really want to get a boy, then you should have intimacy on the day of ovulation, because then you're more likely to have the boy. And if you want a girl, then it should be a bit earlier, so that by the time the egg is coming down, then the sperm that has survived for longer is the female one. There is no 100% validity of these methods, because there are those who try and it works. There are those who try and it doesn't work. But you specifically asked about after ovulation, and chances of you falling pregnant after ovulation is very low, because as I said, once you ovulate that day, you have 24 hours. So any day after that, then the chances of you falling pregnant are reduced. But if it's on the day of ovulation itself and up to 5 days before that, because that's the time that the sperm is thought to survive in the female tract, then chances are usually high. So yeah, that's where those calendars come from, basically. Yeah.
I have a question.
Is it Millicent? Yes, go ahead.
Yeah, I have a question. What happens when some people get pregnant way after ovulation and it's a time that is speculated to be a safe day? What exactly happens during that time?
Okay, so there's usually when, as I said, usually ovulate 14 days prior to when you get your period. Okay, now when you ovulate, and that means that you should have a regular cycle. So that thing only works if you have a regular cycle. Now there are some people who may have irregular cycles, and that means that from 1 month to the next, it changes. So if you don't have a regular cycle, then also the timing of your ovulation is changing. So if this month your cycle is 28 days, that means you ovulated on day 14. If the next month your cycle is 30 days, that means you're related on day 16. So there's a difference. And by and large, that's what has been shown to cause these people to fall pregnant on the days that were considered safe days, because basically their cycles were not regular. So normally, if you're going to use safe days, and safe days have been shown to have their failures as well, because it's not 100%, and that is because you may then ovulate on a different day. But if you are having a regular cycle and you're tending to also look at the factors that, and you've been able to assess, if possible, just by checking the cervical changes, your body temperature changes, then ideally one should be able to stay away from getting a pregnancy in the unsafe days. Yeah.
Okay.
I have. Is there any treatment for infertility? A sure treatment that will work?
Sorry, Alice, please repeat your question. You've asked if there's a
treatment for infertility for both the women and men.
So as I said, it depends on the cause. And yes, there are treatment modalities. So for example, if the lady is not ovulating, we usually want to find out why is it that she's not ovulating, and we can be able to give drugs to help her ovulate. So it basically depends on what the cause is. If there's an issue with the tubes, then normally that one requires some surgical intervention. If it's possible, to see whether you can do what's called a tuboplasty, where you try to open up the tubes. For the men, if there's an issue of maybe the sperm, then normally there are some certain supplements that can be given, or if at all they are not producing any sperm, if there's a blockage, that may require some surgical treatment. And then in cases whereby we cannot do anything in terms of medical or surgical, or we're not finding even the cause, then that's where assisted reproduction comes in, whereby what is offered is now things such as IVF, whereby they get the female egg and the male sperm, and we put those together. And once the embryo is formed, we put that back into the mother's body, and then a pregnancy can be achieved through that way. So yes, to answer your question, basically in short, I think I can say that yes, there are various treatment options. Some of them are simple, some of them are quite complex, and so they may end up being quite expensive in the long run. Yeah.
And what can lead to one having the artificial insemination?
So usually artificial insemination is a fertility treatment option that's usually offered in cases whereby sometimes we have unexplained infertility. So we want to make sure that, okay, here we are putting in the sperm, because what that is basically is taking the sperm and putting it into the lady, yeah, at the time that she's about to ovulate or has just ovulated. Now, the other things that sometimes you can find that maybe the sperm count of the man is very low. And so if at all this man is producing this sperm and we are waiting for, because when you produce the sperm, they usually have a treacherous course. Like before they get to the egg, there's millions of them that die off. So if you find that the count is low and want to increase the likelihood of this lady getting pregnant, then we take the sperm and we take it closer to where it's supposed to end, so that you reduce the chances of them dying off before they get to the target. So those are some of the cases that you may want to use what you're calling the artificial insemination. I think Iziana, you had a question, Iziana? I can't hear you, Iziana. I'm not quite getting you. Hello, yes. Sorry? Maybe you can type your question, Iziana, in the text, because the connection is quite tricky. I can't quite get what you're asking. If you're able to type in the text, yeah, let me see in the chat.
I have a question still. Like,
yes,
are there
Millicent.
certain foods that would?
Are there certain foods that what?
Are there certain foods that can lead to infertility or to premature menopause?
That's a good question, because nutrition is a very important aspect, which usually can cause you, at least, especially in terms of having healthy basically pregnancies, then usually we give very good advice. We always are strict on what it is that you're eating and what you shouldn't eat. Now, in terms of specific foods that can cause you to have infertility, there are none that are known of, but there are toxins which have been associated with infertility. And so those are things like use of smoking. So ladies who smoke have been shown to have decreased ovarian count. And so that can also result in one getting poor quality of eggs, which can then affect your, whether you're able to conceive or not. And then it can also result in you having earlier diminishing of the number of eggs that you have. So smoking is one, and also excessive alcohol intake, and also use of drugs of abuse. Those are the ones that have been shown to basically affect one's fertility, and also can affect risk of getting premature menopause. However, in terms of just ordinary diet, no, there's none that, like just eating your normal carbohydrates, proteins, vitamins, there's none that has been shown to be linked with infertility. I'm seeing there's a question that Iziana has posted. Okay. How come a 70-year-old and above woman gets pregnant, and menopause lasts for how many years? Now, as I say, the median age of menopause, that's when most of the ladies in our population would get or would achieve menopause, is 50 years. Usually it's plus or minus a couple of years, about 2 to 5. It is very unlikely that a 70-year-old would get pregnant from natural means. So usually by that age, the eggs are done. But still, there are, as I said, artificial methods. So in some countries, and you can read about it in magazines and all that, lots of celebrities tend to delay their getting pregnant. And so what happens is, as long as you have a uterus, that is what carries the baby, the womb. And so they can be able to get eggs from a donor and use that egg with a sperm to do what I described is done in IVF. So they get the egg, they get the sperm, they put it together, and they put it inside the uterus of this lady after they have primed it, obviously. And she can be able to carry that pregnancy to term, and she can be able to deliver. That is the most likely cause or occurrence if someone is actually that age and carried a pregnancy. And menopause lasts up until from 50 years onwards. It never reverses. So there's no point that you can say it lasts like 10 years, 20 years. So it's a state that you then move into, you know, because like, for example, before puberty, you don't have any period. So that's that pre-pubertal phase. Then from puberty onwards, you're in your reproductive phase. And then after that, you get to menopause, whereby you're now no longer able to have reproduction. So up until the end of your life. So what's the color of a healthy sperm? You're not really able to see the color because, you know, it's a mixture in the ejaculate. And so what I think maybe you might be trying to ask is, you know, how does that ejaculate look? And a healthy one ideally should not have a smell, should not have any blood, should not have any pus or anything of that kind. But the way the ejaculate looks differs depending on how many ejaculations one has. So the longer one takes before they ejaculate, then it's a bit thicker, and so the color would be whiter. And then now the more ejaculations one has, then it becomes a bit more watery as the amount of sperm in it reduces. And then, can a sexually inactive man produce healthy sperms? Yes, he can, and men tend to produce these sperms, and usually they tend to have the sperms just coming out sometimes because if they're sexually inactive, and that's what is typically known as the wet dreams. But yes, the sperms that they are producing are, yes, should be healthy. And then what is in vitro fertilization? So in vitro fertilization is a type of assisted reproduction. Basically, when we say assisted, it means that the lady and the man have tried conceiving naturally, and that hasn't succeeded. So what we then do is in vitro means you're creating the environment, and this is usually in the setup of a lab. So basically taking the egg from the lady and the sperm from the man and mixing it together in the right environment to ensure that it has the right nutrients, you ensure that it's the right temperature, and incubate it basically to achieve fertilization. So what is usually achieved in the body is being achieved outside the body. And then once that has taken place, the fertilization has taken place, that embryo is then put back inside the lady's body to continue growing as it naturally would. Yes, so can one menstruate and not ovulate? And that is, can one be getting menses and have a problem conceiving? So those are two different questions, and I'll answer both. Yes, one can menstruate. Sorry. One can menstruate without ovulating, because what your menses are, and I think there should be a talk about menses in this cohort, but when you get your period, it's a function of two things. One is the egg that has ovulated, it comes out and passes in through the uterus, and then it comes out through the vagina. Now, the uterus itself has an inner lining, which is always preparing and getting ready in case a lady gets pregnant. However, if you don't get pregnant, then that lining is also shed together with the period. And so most ladies would know that there are times of the cycle that you may see fresh blood coming out, and then sometimes you see something like clots coming out. That is usually the lining of the uterus. So even if you're not ovulating, it gets to a certain point where this lining has gotten thick enough that it just sheds itself. And so you do get a period, but you have not ovulated, okay? And can one be getting menses and have a problem conceiving? Yes, you can. We talked about the tubal blockage. So you can be ovulating, but this egg is not passing into the tube to meet with the sperm, or it passes midway and it doesn't get all the way. The sperm cannot get to it. So you would still get your period because, as I've mentioned, the lining of the uterus would shed and you would not be able to know that you're not even ovulating unless you go for an ovulation test. Someone has said, Michelle has said, we say something on surrogacy. And surrogacy is whereby you have someone else, that's the person called a surrogate, carry the pregnancy. Now, basically we utilize, what is utilized is the in vitro fertilization model for that. And so it could be your egg and your partner's sperm that is then put together inside basically in the lab environment, as we talked about. And then this is then put inside now as another lady's body so that she carries the pregnancy. Maybe the first lady cannot be able to carry a pregnancy. There could be an issue with her uterus. And even in some cases, the uterus could be gone, but you still have your ovaries, where we do a hysterectomy and we don't remove the ovaries. So that can be a type of way for pregnancies to be achieved. Now, in some other types of surrogacy, you find that they use the surrogate's own eggs, and now maybe the sperm is the one that's from the partner. And so the pregnancy is then achieved in that surrogate mother, who then carries the pregnancy again to term and delivers. Talk of erectile dysfunction and conception. Okay, I don't know what exactly Jeria wants me to talk about, but with erectile dysfunction, basically what is happening is that you're not able to achieve an erection. And so if one is not able to achieve and sustain an erection, then usually for you to have sex, that is the first thing that is needed. You need to have penile penetration of the vagina. And so if that is not happening, then we're not able to, in most places, get to the point whereby you're ejaculating inside the female reproductive tract. So that's how it then comes about. There's also the element of premature ejaculation, whereby a man then ejaculates even before he then penetrates. So that can now also affect the chances of conceiving. What environment is that specifically, Alice? That is a very detailed question because I'd have to talk about so many chemicals and nutrients that are given. And basically, I think the simplest way that people used to talk about IVF is to call it test tube babies, because what you do is you take the egg, you take the sperm, you put it in a test tube, and you just make sure that this is incubated in the right, with the right nutrients, with the right temperature, and you're doing the right monitoring for it. So there's lots of chemicals that are put into that process, which I think are beyond the scope of this talk for today. And why do implantations fail to occur? So implantations can fail because of a number of things. Significantly, what we mentioned is if you have an issue with the uterine cavity, like for example, if you have fibroids in there, a growth that's inside there that makes that environment now just not receptive for the fertilized fetus, then that implantation can fail to happen. If you have the lining of the uterus being too thin or being too thick, yeah. So there's a way that even in this, even when the fertility experts are doing basically the in vitro fertilization, and it's the same thing. They just try to ape what happens in a natural cycle, because it's been shown that at this size of the uterus lining, then that's the best time for implantation to happen. And they tend to look and try to ensure that the lady, before they then put in that embryo, that has been achieved. So if that is not achieved, then implantation can fail to occur. So basically, it's more of a function of the lining of the uterus and also the hormonal balance inside the lady's body at the time that embryo is being put in. Can one be done hysterectomy and still menstruate? No, because hysterectomy is a removal of the entire uterus. So that is usually the channel for the period to come out. So once a hysterectomy is done, you have removed the uterus. So she can still ovulate if the ovaries have not been removed, because the ovaries are not are not inside the uterus. They are attached to it by a tube. But basically, one can not menstruate if they've had a hysterectomy. Yes. I think that's the last of the questions from Alice. Is there anything else? I think in terms of time, we have 10 more minutes. Yes, Iziana? Hello.
She asked, can one menstruate and not ovulate? Another one, that is, can one
I think I've had from Dorcas, the question from Dorcas, the one from Dorcas I'd already answered about whether one can menstruate and not ovulate. So that one I have answered.
have, like, is there a treatment for premature menopause?
Sorry, is that what?
Back.
Kindly repeat your question, Alice.
Is there a treatment for premature menopause? Yes, I'm asking. Are you getting me?
Mm-hmm. I'm hearing the first
Hello,
part, but I'm not hearing the rest. Yes, Alice, I can get you now. Mm-hmm.
Yes, I was asking, is there a treatment for premature menopause? Like, can it be reversed back so that it can be normal again before the menopause time?
So the thing about premature menopause, what has happened is that once has lost all the eggs that they had. So I don't know whether you managed to see the slide that I showed, whereby the deterioration in the number of eggs as one ages. And so what that means when someone has premature menopause, it means that all their eggs are done by the time they're 40. So unfortunately, that cannot be reversed. However, there's another condition called premature ovarian insufficiency. Now that one, what happens is that your ovaries are not behaving as normal. And so maybe you're not having your periods. You can go for like 6 months without having a period. And these are people who can actually get pregnant. Yeah. But they still, because they still have eggs, it's just that they're not being behaving as normal in terms of being ovulated as they should. And that can be linked to now similar condition, the autoimmune diseases that we talked about that can cause premature menopause. So even in the phase that before one gets to premature menopause, they may now have this phase where they have ovarian insufficiency. Basically, the eggs are not behaving the way they should at that time, because they should be having like regular periods and all that. And maybe there's a delay in conceiving, but they still have a possibility of getting pregnant. However, once you get to the point of premature menopause, all the eggs are done. So that cannot be reversed for you to be able to now start having periods and continue maybe with your reproductive life. But for the symptoms that one has in premature menopause, one can be given hormonal therapy, which I mentioned, and that can now assist with the symptoms and help prevent complications. Yeah. Hello? Iziana. Again, I'm not getting you too well. Yes, Iziana. I'm not able to get you again. I'm not able to get you.
Let me take.
Maybe just write in the chat. In terms of time, I think we have maybe about 5 more minutes. Does anyone else have a burning question? can you get periods after tubal ligation? Yes, you can. And remember what I mentioned about basically the lining of the uterus also being shed every month. So even if the egg is not able to pass through the tube because the tube has been ligated, that lining, once it gets to the right size, it will be shed. And so you will still get a period every month up until when you get to the menopausal age. Now, please just touch on egg freezing. So what we call egg freezing or egg preservation basically is something that is offered, one, to ladies who may, sometimes, you can be diagnosed with a certain condition, maybe, for example, a cancer, and one is going to undergo a certain type of therapy, which can then be harmful to the eggs. So that is offered. And basically what happens is that the eggs are taken and they're stored in a frozen state up until the time that one would want to then have a child, and then they are taken out and they can be used. Now, the other situation whereby egg freezing is offered is usually in part of the in vitro fertilization. When we're doing that assisted fertilization, sometimes the eggs may be harvested, and when they look at the lady's body environment, because remember I talked about how the uterus needs to be of the right size. If they look and they think that if we implant this embryo right now, there's a high likelihood of failure, then that batch of eggs that has already been harvested from the lady is frozen and maybe can be implanted in another cycle after another month of ensuring that now the uterine size is like the right size basically. So I think that's it in terms of eggs freezing. It's an option for people who may also just want to have children later on in life, and maybe you're not with the right partner. So eggs can actually be frozen for years. There's people who are frozen for even up to 20 years. So yes. Do these prenatal vitamins really work? Yes, they do work because ideally you want to get a good environment for your ovaries and eggs. So the most important prenatal vitamin when you're trying to get pregnant is folic acid, but there are many other micronutrients which are now included in these prenatal vitamins that their goal is to try and improve the quality of the eggs that are picked for ovulation in those months that you're taking it, so that you have a higher likelihood of achieving a healthy pregnancy. So yes, someone who's asked about prostate cancer, which, well, it's not in the scope of this lecture talk, but we'll talk about it briefly. Prostate cancer is a cancer that affects the prostate of men, yeah? So it's thought that it's something that is familial. So basically there can be a genetic aspect to it. So if there's someone in the family who's suffered from prostate cancer, then usually there's a risk of then someone in that family having it. There's no one specific cause, but there are certain risk factors, things like using toxic things, once again, in terms of smoking, that has been shown to be associated with prostate cancer. So it's a cancer that affects men usually over the age of 40. And so there's usually screening for the same that men can have done. And it's usually just a blood test that is carried out. So it's usually encouraged for men who are above 40 that they should then have that screening done, because the symptoms of prostate cancer sometimes are masked because many men get those symptoms because the prostate tends to get larger as men age. So they may have difficulty when they're trying to pass urine, feeling like there's a bit of a blockage. And so some men may assume that symptom to just be the normal from prostate enlargement, but it needs to actually be checked. So even if they don't have symptoms, it's recommended for men to just have screening for prostate cancer once they get to 40 and above. Yeah. So I've seen Indiana has sent her thanks for the session and says that you've learned a lot. And so I think in terms of time, we should be done for today. Thank you so much for attending, and so sorry for the challenges in terms of technology, but yeah, it's been great, I think, by and large. So okay, thank you. And good night to you all, and happy Easter. Bye.
Okay.